Springer. Kelly, how are you? And I know you're excited about our guests. Definitely have some relatable topics and how you serve the community. Kelly, introduce our guest.
Yes, so welcome to Talk Nutrition to Me. We're so excited and thrilled to have special guest Randy Peled, founder and CEO of Feld Care Connections. Randy is leading the way in connecting skills and clinicians and healthcare agencies to ensure patients receive the highest quality of therapy services. Her work transforms access to care and improving patient outcomes nationwide. Randy, welcome to the show. Can you share with us how Feld Care connects in making a difference in therapy and staffing for patient care?
Absolutely. Well, very nice to be on the show, and thank you for inviting me. So, FeldCare has been connecting home health agencies and clinicians since 2012, 2013. We started in California, and our sole purpose is to help the community in primarily the elder population. So, we have a network of clinicians, physical, occupational, speech, registered dietitians, and the home health agencies don't have enough time to find the therapist to staff their patients and to help their patients. So we simply put them together. And
Hmm.
we have a whole administrative staff, over 50 people that are making sure nothing falls through the cracks. But we are nationwide, we're in several different states, and the process is very, very simple.
That's incredible. I get it. So I don't know if you know right now, but the New York State is actually just starting the 1115 waiver, which is all about social care networks for Medicaid. So it's really interesting that you're pairing all these different things together because I think that's been lacking in healthcare.
And it has, specifically, I'm in the home health industry world, if you will. And the agencies are so intent in trying to find those nurses that they can't find the rehab for the patients. So
Mhm.
that's our focus. But you're right in terms of community, insurance, social support.
Mhm.
There's been so many areas that are lacking,
Mhm.
not enough funding if we go into that whole area of discussion. And it's how we provide those services. There have been significant changes in Medicare, obviously, that have caused reductions. It changes in home health, patient-driven grouping model to value-based program. The value-based program has unfortunately cut significant resources to the patients in the home.
So I want to dive in a little bit about that and the service of care. A lot of people don't know, even as a registered dietitian, that they assume that Medicare would cover nutrition services, especially if it is referred from a physician. And unfortunately, still to this day, they only cover diabetes and chronic kidney disease. We personally have a waiting list of about 250 Medicare people that are waiting to be seen and don't have the funds. So I want to learn from you. How are you helping, or what do you get funding? Like, how do you get funding for the services that you provide?
Yeah, so first of all, that's a great question. Specifically for registered dietitian,
Mhm.
Medicare and Medicaid does not, in the home health world, does not reimburse,
Yeah.
right?
Yep.
One of it's so important, nutrition. We have, malnourished or, non-thriving elders, and there could be dysphagia issues that are related to that specifically. So, our position, if you will. And again, it's driven by the home health agencies and the nurses and the doctor, but the insurance doesn't reimburse. So it could be that a speech therapist might recommend registered dietitian to come in, do, do an assessment to determine the condition of the patient
Mhm.
and come up with a plan on diet and nutritional plan on how to assist the patient. So it's not paid for by insurance. The agencies are covering it out of pocket. It's unfortunate
It
because
is.
it's very much needed.
Well, I think this is a fantastic conversation. It's so timely, and like when we talk to even different politicians, they don't know the fact that this isn't a covered service. They would assume that Medicare would cover a medically necessary assessment or intervention, and it's not.
Yeah, correct, correct. And where, because the speech, so if a PT, OT, or speech, in my world, if you will, or a nurse, obviously, if they're recommending that, then there's an obligation to provide the service, whether it's paid for or not, right?
Wow.
So, so,
Okay.
that's why the dietitians are, that's why we're providing this service, because it is function and it is rehab and it's to support the patient. But if no one if no one suggests it, then it's not going to happen. So we actually push, we send out newsletters to the agencies. We talk to the speech therapist specifically because there's more of a relationship between the speech therapist and the RDs, registered dietitians, nutritionists, and respiratory therapists, to be honest. So we provide education, if you will, on how there could be more of a collaboration in
Mhm.
working together and supporting the patient just to get at least that one assessment.
Yep, absolutely. So, do you get private funding? Like, or do you have a non, is it a nonprofit or how are you
No,
just,
we're profit.
so you're just taking a loss on covering that?
So be, so first of all, we do have two programs. We have
Okay.
that we partner with the home health agencies. We have a network of clinicians. The home health agencies are the ones that are billing for
Mhm.
the services. So they're paying, we're the biller essentially for the clinicians that are going in. So we're getting paid for those services to pay the clinicians, right? It's the home health agency that's taking that loss. And that's why very rarely will they approve more than one visit for an
Mm.
RD. Sometimes it could be to just to do a follow-up and make sure that there is that it's the right program, that there's change and some weight increase, if you will. But it's very, very rare. It's usually one consultation. On our outpatient program, we don't get reimbursed, so we don't do it.
You know,
Well,
I want to,
oh, go ahead, Neil.
I want to jump into this in-home health
Yeah.
for our listeners and viewers out there. Define in-home health, like how the in-home health agencies work with in the home. How does that work?
So our home health
Yeah.
agencies send the referral. The therapist will accept the referral based on their availability. We have an app called Clinique Connects. It's kind of like Uber for home health. They can accept or reject the patients. And internally, administratively, we make sure everything runs smoothly. The home health agency is billing, the therapists are documenting, and it's relatively simple in that respect. The outpatient in home, it's not home health. It's just a concierge service. It's Medicare Part B or Medicare Advantage or private insurance. And instead of seeing the patient, the doctor sends a request, not for home health, but the patient just doesn't want to go to a clinic. They want to have the service at home. Simple as that. It's just outpatient in home. We do service all ages. It could be anywhere from birth to 120, if you will. And we're billing with CPT codes. We're using the EMR system Raintree, and it's a totally different model.
Wow. How did you get this started?
The 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 whole program.
Yeah.
Yeah.
I've been in my master's work was in occupational and environmental health science, so I've always been into how to support the community and looking at different programs. But when I came out to California back in '91, things a long story short, I met up with a really good friend who was an occupational therapist, and I started working for her in early intervention in totally different population. And then we opened up an outpatient clinic, and we did schools, and we did home health. We opened up a home health agency, and that was a great experience to have just to see like the baseline and the foundation of how it actually works in a home health setting. And from there, I just evolved more into the therapy world. I love the elder population. I want to support that specific community. And then I went off on my own. And
Well,
family business, kids, husband, my older son is very much involved, and we've just grown.
And he's brilliant. I got to meet him yesterday, Kelly, and on a
Thank
meeting.
you.
He is absolutely brilliant. And Feldcare and Kelly's Choice. Wow. If I was looking at two amazing companies that are going to continue to grow in the next 10 to 20 years and become a real family, amazing businesses, I see those two. One thing I wanted to address when you talk about early intervention, Kelly, I don't know if you knew this. I was a birth to three developmental therapist at one point in my life. I would do behavioral therapy going in for birth to three to say, really, there's behavior issues in 1 and 2 year olds. There are. And then I also did developmental therapy. So I understand that in home health, it's a very interesting how the billing, the codes, but it really helps, I guess, to be able to work in home to get people. So I see how important it would be for more registered dietitians to come
Yeah.
to the home because that's where you're going to get to see the kitchen. You're going to get to see the refrigerator. You're going to get to see a lot of different things that you don't really open up the closet door when you go into a session in like a facility or even a virtual visit.
Well, Randy and Neo, something that you don't know is that we started a nonprofit called Nutrition Education for All, and just this week we got it kicked off. Uh,
Wow.
so it's really exciting. We got our president, vice president, treasurer, everyone together. And the number one reason is to help support clients that have Medicare. So I think it's going to be extremely successful. Like I said, we already have a waiting list of 250 people in our local community that have been referred from physicians. And I hope, Randy, that we can grow this nonprofit to be able to support all of these people that need nutrition care and don't have the means to cover it. So I'm excited. We're also getting into schools and early intervention that way too, but kind of the same spots of the children to the elderly. We're trying to support the underserved. So it sounds like you are as well, and I just applaud you for what you've done because I think having that support is so necessary. My dad just had a knee surgery this week, so
Okay.
we're
Hope
talking
he's
about
doing
like,
well.
yeah, yes, but like, what does he need? How does that care work? What does he have at home? Can he do stairs? And there's so much need of what you're doing, and I think it's fantastic.
Thank you. And likewise, certainly, one thing I didn't mention, a couple of things, but because there is quite a bit of need for nutritionists and RDs, and they're not maybe local in a specific region. Like we are, just taking California alone, California is rather big. So, we might have a registered dietitian in Los Angeles, for example, and the patients in Oakland or San Francisco. We don't have an RD over there. So one of the things that we could provide and support is RDs via telehealth for the patient. So it could be that there is a connection in terms of providing that support from you guys to the different states that we're in. We have to, I think that's a discussion that we have to
That's
talk
why I
further.
put you
I
guys
know. I'm
together.
Yeah.
excited to take.
I'm the connector, Kelly. You've already noticed that about me, and it just continues. But let's go to one thing that's really important, Kelly, for our listeners and viewers that look at a potential entrepreneurial opportunity. What you've been able to build, Kelly, with Kelly's Choice, and what Randy's been able to build with Feldcare Connects. Now she's offering opportunities for franchises. Can you go a little bit into that, Randy?
Sure. Thanks for bringing that up. So, you know, uh, Feldcare is a business model that we started from the ground up, and we have an entire training module um, in terms of franchising and bringing on people that are interested and that want to help the community, but they don't know how. So we have a whole pathway of that process. And for entrepreneurs, for individuals that might be therapists and they don't want to do one-on-one and they want to support the community. We have a whole system in terms of training that individual and providing support in how they could actually come on, purchase a franchise of Feldcare and develop it anywhere. We all know that the aging population, the baby boomers are the largest population in the country or everywhere actually. And there's an enormous amount of support. So to be able to take a model that a proven model that exists and have a whole entire runway of training and support, we've developed that. So we're really excited about it. We launched it a year ago where obviously franchisees can open up in any state that they want, but there is a humongous need all over. So yeah.
There is. And I can't wait to see where you take this and also to connect with you after this podcast, because I do think there can be some great synergies together and we can help on that dietitian front. So it's an exciting time. And I think telehealth has opened up so much for us as dietitians so that we are able to be in multiple locations at one time. So it's pretty cool that technology has helped us too.
It is. It's amazing.
Mhm.
I mean, if you look, I mean, there was no such thing as telehealth back in,
Right.
back in the
I wish, and
eighties or
I was
nineties.
presented that
So
idea, and I was also presented the idea of crypto. So I'm not going to mess up with AI now because, like, I heard about telehealth before telehealth was even there, and if I would have been invested, boy, I would be, and maybe who knows where I would be. So remember, whenever those
that
opportunities, those next trends, but telehealth has grown so much.
It has.
it,
And I think the whole virtual life, and that's why every time you see a specific trend, you got to jump on that trend. But I
that's
think
right.
healthcare is really going to be big in the next 5 to 10 years. I have another healthcare client I'm about to be bringing on as well. And I'm just blown away. He'll definitely come on your show as well, Kelly, how to save companies on healthcare insurance. So, really, an amazing thing that he knows the system, and it's so important for people because we don't know, and we need to have the experts to talk about those things. Kelly, what else are questions you have for Randy? I have one more for Randy to cover before we
Well,
go.
I just think, Neil, what you just said too. I mean, the fact that we can do this podcast living in three different states, getting to know each other and connecting the dots to actually serve people is what we're trying to do. So I just really appreciate you coming on, Randy, and thank you, Neil, for this introduction because I'm just blown away at who's doing such great work out there and how we can connect.
Absolutely. So the last thing I want to go to Randy is Randy's looking always for therapists. First, we talked about Clinique Connects, and Randy
Money
has
connects. Yep.
that you can check that out. That's how FeldCare is able to connect with the patient and also the provider. It's a three-prong thing, right? The patient, the provider, and FeldCare,
Well,
yeah, in a way.
so yeah, it's more of the home health agencies the the patients are available in terms of the location for the therapist to determine how the proximity, how far they are from that patient, so they can either accept or reject based on those scenarios. There's a lot of other parts to Clinic Connects, but it's a great tool. It's an amazing tool.
Absolutely. Okay, so she's looking for therapists. What areas are you really looking for therapists, Randy?
So yeah, so again, therapists all over. I mean, we're in Hawaii, Arizona, California, Texas, Florida, a couple other states, Nevada. But um, it's so needed. Rehab, PT, OT, and speech, some RD. Again, I know we're going to talk offline specifically about that, but we have such a big need. Um, California is humongous. There are just not enough therapists. And there's an enormous need that is coming in every single day through our portal to help these patients. And we're constantly um, posting, recruiting, and meeting people, going to conventions. I'm going tomorrow to USC Keck Graduate School University for OTs. So we're out there all the time in front of people trying to find these clinicians.
And that's great. And I'm really interested in this early intervention thing because I remember those experiences for sure. Randy, best place we can connect. Where can we go? Your website.
Yeah, you can come to www.feldcareconnects.com, and you can always call us directly at 818-926-9057, and we are here to help.
And best place for Kelly's kellyschoice.org. But also remember, make sure you like and subscribe to the YouTube channel, like and subscribe to the podcast. And lastly, you need to pick up Kelly's book and tell us, Kelly, where we can get your book.
Yes, you can go on Amazon. It's called The New Weight Loss Era. You can search my name, Kelly Springer, or you can search New Weight Loss Era. But our book is released and super exciting. It took a long time to get there. And so very, very proud of a whole team that came together to create that book. So
Uh,
thank you.
All
that's
right.
great.
All right.
Congratulations.
That was
Thanks, Randy.
appreciate it. All right, guys. That was the special simulcast of the Neil